let's get into some discussions. Common theme across all three is social support, it seems, right? Talk about not just getting things off the ground, but this idea of sustainability. I'm very impressed about moving from DC here at ground zero all the way to out across the country. Linda, what do you think is the key reason that social support clicks with your program?
It's fun.
Fun.
It's fun. I find that most of the people that I deal with, when I talk to them, they are not clear about what the definition of health. They think health means the ability, you're sick. And that means, that's their definition of health. And it means so much more than that. When we start talking about the ability to have choices, and we start talking about things from the inside out, they began to get motivated. So it takes us talking about those things and talking to that person about what they want. Again, the ability to have choices, to find meaning in life, just to be a part of life. They get more involved, and then they get around like kind. And that social environment makes them want to come back again because it's a feel-good thing. It's intrinsic. And that's what they love. And that's, I believe, is what we have to create in order to keep people doing it. I think physical activity should be like wearing a seatbelt. If you don't wear one, you feel unsafe.
I've heard a lot of analogies over the years. That's the first time I've heard that. That's a good one. That's a good one. Dr. Dietz.
Bill Dietz, roundtable member. Thank you for those three examples. And if I understood you correctly, each one of those had external funding. I wasn't so sure about yours, Linda, but two questions. The first is, if you are dependent on external funding, how do you sustain this program? And Marisa, you suggested there were some elements that were already in place, but I'd like you to amplify that. And secondly, what is the evidence that physical activity in your constituents has increased outside of your program? To what extent has this become embedded in the cultures that you've addressed?
Just start with Sean.
Yeah, I think I can jump on the last question first. For us, it's ingrained in what they're doing at a young age. So we started third grade, and for the kids that enter the program, then our program's third to eighth grade. So they have an opportunity to continue in DC scores from that point until they leave middle school. We've strategically clustered our schools also so that when they leave an elementary school, they will be likely going to a middle school that also has DC scores programming for them to continue. We'd like to do much more with our older alumni group, but we still see those kids seeking additional playing opportunities down the road. I don't think that we could put direct evidence that we've created varsity high school teams in DC, but pretty close. And I know we've been able to create junior varsity teams just based on the pure interest, especially from females in DC, moving from that 8th grade to ninth grade. So from a soccer standpoint, it's much easier for us to put a finger on. I think with the nature of continuous competitive games and the structure for them to play on, and it's pretty easy for us to provide that. So I think it's a little easier for us.
Yeah, with Shape Up Mississippi and Shape Up Sisters, Shape Up Mississippi has the walking clubs that are once a month. I don't know whether you saw the walking club. You see people out there. We can gauge by the participation of the people in the walking club. At Shape Up Sisters, we do a thing whereas when you're there, we measure your body composition. And so we're able to tell, because every month you get that done, we're able to tell whether it is physical activity is making a difference. And it is making a difference. It's one of the ways how we found out we lost 15,000 pounds is being able to take those measurements. And when you come to Shape Up Sisters, you actually step on a scale and it gives this computer printout. That computer printout goes in the file. Many women come back, even if they went on vacation or they stopped coming because life happens. They come back and they say, oh my God, I haven't been doing anything. Well, we're able to look back and to see where you started from. And this encourages them to go on. So these are two ways we measure whether physical activity is working.
So I think for us, it's a little bit complicated and difficult for us to tell, what physical activity is happening outside of our program. What we do know is that it's an active part of the instructor, the community health worker, to encourage them to get together outside of the exercise classes. Now, what we did do is we recruited out within like a center, so within a school per se, you'd have 2 exercise classes there. But what we were also measuring was how many classes outside of that center where they came from they were attending. And we know that some ladies were traveling and going to 6, 8 classes a week in different locations throughout San Diego and throughout our area and our community. And so, it is definitely difficult for us to say, outside of our program, whether or not we do measure physical activity, and we know that their actual amount of physical activity is increasing over time. Whether that's, related to our program or not is difficult for us to say.
So thank you. What about the sustainability part?
Yeah, absolutely. So, for us, what will be interesting, we'll see how the program continues now that we're a little bit farther outside of the funding period. What we do know is that, for example, the school system and the recreation centers have both adopted our instructors without a local agency supervising the instructor, the community health worker. And so what that looks like is, in the recreation centers, they may be actually charging a small fee for the exercise classes, like $2 a class, and half of that money is going to the instructor, and then half of that's going to the recreation center, therefore kind of maintaining that in place. Within the school system, we have had schools offer to pay for liability insurance for our instructors in order to keep them within the school. They find that it has so much value for their parents and the community that they have decided to just keep it on. And it's not costing them any money besides maybe paying for the liability insurance, because the classes are free. The instructors are providing the classes as volunteers, and the maintenance staff are there to unlock the doors in the evening. So there isn't a lot of cost incurred. Now, as far as expanding the program, that would be different, because we did provide a lot of training. We did pay for the community health workers to get Zumba certifications or to take other types of trainings. So that might be something for us to look at in the future.
For sustainability, one of the things that I did not get to mention is walking trails. Partnered with the city, and being on the committees, we talk about walking trails. Well, in the existing parks that we have, they need maintenance and they need care. So what we did was went around and we asked where the children skate and where they swim, can we put a 1/4-mile walking track around there so that parents can walk around as they watch their children? Well, we were able to get a grant to do that. Right now, there's another grant at a tennis court at another existing park. That's another 1/4-mile track that we're putting in there. Also, I'm on many boards, from Main Street to the Chamber of Commerce, any place that would hear me. But we're also there, we have walking trails throughout our historic downtown Vicksburg. And so when you walk, there'll be these little emblems on the sidewalk showing you which way to go. Nice looking tabloids that actually talk about the city. It's good for the tourists, it's good for the people there because it raises civic pride. So those kind of things are sustainable. People are able to get outdoors more. And if I can keep talking for one moment, the Vicksburg National Military Park that we have there, that's a Civil War park. We have a problem with African Americans not really wanting to walk that park. To get African Americans in that park, that was a partnership with the Vicksburg National Military Park to allow them to walk for free, to let Shape Up Mississippi have walks at least 4 times a year where that park is open up for free. So it's these type of partnerships that help shape people's behaviors that make it sustainable, I think, to help make it sustainable.
I think you definitely hit it on the head, though. It's a sore spot for us, and I'm sure most small nonprofits. It's kind of the nature of the beast, and we will leverage those same type of partnerships. And we've been in some schools since '94 when we opened, so we're part of that community and ingrained in that culture there. And they'll bring us to the table for different types of government funding and things, opportunities to pop up like that. But for us, the the focus in the last few years has been to try to gain more individual donors on a longer term that gives us that longer term projection so we can know what we have a few years ahead of time. But it still hurts.
So one of the challenges oftentimes in programs like this is it's hard to know whether actually moving participants from inactive to active, or you're bringing active people from somewhere else into the programs, right? Walking clubs once a month, they've got to be doing something somewhere else if they're actually losing weight and their metabolic profile is increasing, whether it's diet or other kinds of activity. A walk one time a month probably isn't enough to make some changes. But do you have any ideas about each of your programs of, are these actually reaching people who aren't active, who aren't poets, but who aren't active and are actually transforming inactivity to activity rather than just shuffling the decks, shuffling the cards and having active people come to you now rather than do something else because of the social support aspect of things. Marisa?
Sure. So I can start with, I guess, that more than 80% of our population within our group is overweight or obese. So I don't think that we started with a particularly active community. But what we know is, of course, among our study participants, that our baseline data is really indicating that they're not experiencing or participating in leisure time or workplace or, in our case, we have a lot of women who are stay-at-home moms, so workplace activities, as in housework, are not, meeting any guidelines towards meeting physical activity. So that would be our indicator that we're bringing in that population.
There's a group of people out there that simply say, I want. And there's a lot of them that they're not even thinking about physical activity. When I go into the neighborhoods in the underserved community, because that's the population that make up the biggest parts of these numbers, we have several federal housing tracts there. And I go into those communities. We have walks in those communities. And when we walk, we give them all bags and they go around and they pick up trash. But again, they get together on a social thing too, because they enjoy just getting out into the neighborhood. But so you can understand, when we go and we recruit the people to do this, what they do, a lady sits out in her lawn chair, look like it's gonna collapse underneath her. We walk up to her and we say, we have a 6-week program. It's nutrition and it's also exercise. She said, why? How come do I need it? How much does it cost? We go on into this explanation about it and had no idea, but I figure if we keep coming back to this lady, she will eventually get that message. Well, guess what happened? She did show up for our program. She came with her little child in tow. She was still apprehensive, but she showed up. She showed up because we did not give up. And the best thing she could have done for her 2-year-old was to take care of herself. So going out into these neighborhoods, I make it a point, again, it is the underserved community. It is the African American community. It is African American women. So we have to keep going with the I wants until we get I might, and then we can move them on to I will.
Yeah, our program is free enrollment, so we get students that are interested in soccer, the poetry, some service learning. We get kids whose parents want them to be part of the program, but we also get a pretty fair amount of kids referred from their counselors or other administrators in their school building saying that they really think that this student would benefit from being a part of DC Scores. And I think a great example of that, one of our students who's now a 12th grader joined his 3rd grade year. The counselor approached the coach and said, hey, I know this kid who would really benefit from being a part of a team, was struggling with his weight. He came out to the first game day, was really embarrassed about running around the field and felt uncomfortable. Second game day, same thing, didn't want to play. Third game day, other team comes, there's a kid that looks just like him on the other team that's just enjoying himself, just loving the game. He thinks it's time to go out there, jumped on the field, has played soccer. I can't bet every day since, but I will say he's played soccer every week since that and is now a 12th grader graduating from high school. So, you know, the different ways that kids come to DC Scores is really interesting to me too. Questions?
Hi, Allison Nyheiser, CDC. I have a question for Sean. How receptive are schools to accepting your program, and what type of barriers have you run into?
Yeah, we've got a wait list of probably about 12 schools currently that we just don't have the funding to expand into. So it's really, we wish we could have all those schools immediately. I think some of the barriers have been either, we have pretty strict criteria, their needs, other programs in the building, administration buy-in, certain things that have to happen. I'd say the greatest barriers are just the absolute resources of being able to provide the support that the school needs, and that's from a staffing standpoint to transportation. DC does not provide buses for their student transportation, and we see our game days as a pretty crucial part of what we do week in and week out, of taking kids from one neighborhood and giving them an experience in another neighborhood that they would never ever go in, and meeting friends and having that. And that's really expensive for us too. So making sure that we're not going in and not giving them the full experience that they really deserve, and making sure that the timing is right to make that move.
Okay, thank you. And I have a question also for Marissa then. So with you working in schools, so I'm assuming you're working with shared use or joint use agreements, and with those schools, or how receptive, it sounds like the schools you're working with are excited to have the program, but you know, was there a barrier to getting in, especially when you bring up the liability insurance factor that the school might have been concerned about?
Yeah, absolutely. So it really depends on the administration buy-in. So, you know, the schools where we had the principal who was, you know, really interested or, you know, motivated in providing community programs to their parents and children, that it was easy for us to, you know, come in, and we don't require many resources or anything like that. That was no problem. In the schools where we didn't have an administrator that was supportive of or had other priorities beyond health, it was more difficult to have them, you know, to have our program in those schools. Again, it was really a partnership in that, you know, neither of us were taking much from the other, and it was the community health worker working with, you know, and meeting the janitorial staff or the maintenance staff, and really just, you know, getting to know each other as friends, and you're gonna come open the door for me, and okay, you know, let me help you clear out everything, and so that also helps. So if we had staff members who are really great, and, you know, but that comes from the leadership as well, that was kind of our biggest barrier there. In some locations, if they were worried about resources, we would bring our own soap and toilet paper, and some of the lower income schools. But other than that, there wasn't a cost incurred on the school, and so it wasn't a problem.
Excellent, thank you.
Mm-hmm.
So true, the custodian's the most powerful person in the building. Yeah. So true.
Please.
Iwami Nelly, IOM Roundtable member. And I really want to thank you for the work that you're doing in the community. I think whenever we work with families or children, there is a potential that we see long term. So my question is, have you worked with any of the healthcare providers or the healthcare sector, like built linkages? And if you have, how did you get that started? And how does that really play out or help your program?
Can I answer that?
Absolutely.
In the city of Vicksburg, I work with the doctor's office. To give you an example, there is a lady doctor, and she deals with a lot of female patients that are on Medicaid, on welfare. Well, she referred them to Shape Up Sisters because of that social environment and knowing that we can help them. Well, they don't have the money to do that, but they need to be charged something. They pay as little as $7, and my gym is open for free for those people, every Saturday they're able to come in for free. Anyone can walk in for free. But with the doctor's offices, including we have a weight loss doctor who's there, my brochures are there so that they can come into the gym and work out and get the proper training that they need. Because you can go to a gym and you don't know what you're doing in a gym, and sometimes what you're doing is ineffective. Well, we have a program there where you come in and you're shown exactly what to do, and we have what's called fitness motivators. So they're able to work out with you so you don't work out by yourself. So that's one of the programs that we have for people who are referred by doctors' offices.
Either the other two, community health centers, physicians? Marisa, please.
Sure. Yeah. So we worked with the San Ysidro Health Center in San Diego, and they were actually one of our local agencies that supervised a group of instructors or community health workers. So really, though, the involvement that we had, there was two ways. One of those ways was that they left our exercise calendar on their, in their events, in their waiting rooms, so that people could, grab one as they went out or things like that. We also had some of their other health education type programs and cooking classes where we would cross promote. So we would say, okay, there's a cooking class going on at San Ysidro Health Center. Here's the information about that class, and they would do the same thing for our exercise classes. The other way that we did do a small group, we did a training with the medical residents at the San Ysidro Health Center about prescribing, doing like a prescription pad program for physical activity, kind of training them on what risk factors to look for about whether someone was ready and able to participate in exercise, particularly using the physical activity readiness questionnaire. And so we did that as well. I don't know that that was particularly effective. I think that it was not a primary priority for a lot of the doctors that we were working with, but we did have a few people that were referred to the program through them.
You said not particularly effective for what? Not particularly
bringing people into the program. So actually,
benefit.
Yeah,
exactly.
Benefit. Yeah, so that people actually coming into the program or showing up or calling about the classes or where they could go.
Dr. Fulton.
Hi, Janet Fulton from CDC. This is great. We were having this conversation at lunch today about how to kind of create this culture of healthy cities, active cities, but really from an economic argument. I'm wondering how, if any of you, maybe Linda might be the most relevant person to answer this question, but have you thought about, or do you have experience in kind of taking your program experience and has it been disseminated or translated to other cities from an economic argument? Are people moving to your city because of these types of programs? Can you show economic benefits to kind of the attractiveness of Vicksburg, for example, in bringing in folks moving to your city, economic?
Okay, that's a very good, wonderful question, because I often think that health is economic development. And with the city that I live in, we try very hard to talk about physical activity, from biking trails to, our military park. We promote physical activity because we think that's a part of economic development. When we do that, it makes people want to come to our community to check us out. We're also a tourist town. And many people come in and they just don't, we have casinos, they just don't want to go to the casinos. They want to get out and visit our community. Well, to do that, I find that people come in, people like to walk. We may not like to walk so much in Mississippi, we're getting there, but the people like to walk. So creating those walking trails and downtown tourist trails for people that come in, that make people want to move to our city when they come in and they go, wow, this is a beautiful city. I didn't know you had such walking trails there. We also are working, I don't know whether you saw that big bridge that was there. Okay, this is an economic development tool. It is not used anymore, and that should be a pedestrian park. That's an economic development driver. That is something I'm working very, very hard on with the political people. It takes a lot of push and working with people and consistency of visiting your elected officials, going to all the meetings, making your voice heard. But this is what we have to stand up and do. There's that bridge right there. That could be one of the biggest economic development drivers that we have. Can you imagine how many people will come just to walk across the Mississippi River? Not many get that opportunity. So, yes, working as hard as I can on it.
You know, you can step across the Mississippi River, Minnesota.
Don't tell them that.
Yeah, but we claim the Mississippi River. No.
I don't know about y'all, but I want Linda on my side on anything. Please.
Kathy Greaves, roundtable member. My question, yesterday we had interspersed chicken or egg sort of conversations. Is it reduced physical activity causes the increase in weight, overweight, obesity? Is it the overweight, obesity that reduces the physical activity? So within your programs, is the emphasis about moving, or is the emphasis about losing weight, or do you feel like there's a sort of a level emphasis for both of those?
Yeah, I can jump on that from, I guess, the youth perspective. For us, we're really a youth development program, so it's about youth engagement, the kids enjoying themselves, having fun. We've put a lot of those physical activity components into our curriculum, so we're making sure that all of our sessions have the maximum amount of movement possible. So those things are built in, but for us, a lot of our training focuses on those youth development principles for our coaches, so they know how to build these relationships, create those supportive environments for the kids to really thrive and have that inclusion and take those next steps to be part of that team. So for us, it's about just making the environment enjoyable and somewhere that they feel supportive, and then from there, the soccer kind of takes its own route.
So it's a youth program that happens to have a strong physical activity component, Maurice?
For us, I think that given the training that we provide in the healthy lifestyle intervention, we're kind of looking at it as a whole. So we really focus a lot on, different parts of health and well-being, not just at physical activity, yet the exercise portion is the main part of the intervention. That's the most, hours are dedicated towards the exercise. So while there is the part about, eating healthy, and there's something about emotional health and self-esteem, and we also have a looking at weight maintenance, so energy in, energy out. It's only 1 hour out of all of the time that they are spending exercising. Now, what I will say is that it can also depend on the community health worker. So there is a lot of, if a particular community health worker has their own particular interest in losing weight or being a certain, weight or looking a certain way, then they might verbally, share with participants about that. But otherwise, there is no particular focus on weight loss.
Linda.
Physical activity. I push physical activity. When you do it, you feel good. There is something about the way you feel when you do physical activity that you want to do better. You actually want to think about eating better. You actually want to think about playing with your children. You actually want to think about, going out for a movie. Maybe I'll try meditation next. So for me, it's physical activity first.
Thank you.
Please.
Hello, thank you so much for sharing your programs. I'm Megan Ames with the Maryland State Health Department, and actually just last week I started a new position as the Obesity Prevention and Control Program Coordinator there. So I've got a lot to learn, and I'd be interested to hear from you all about how your state health department could support your programming, whether that be through technical support or funding or other infrastructure support. I'd love to hear your thoughts on that. Thanks.
I can jump on that quickly. I don't know if this even falls under that umbrella. The place we need a lot of assistance with is getting our coaches certified CPR, first aid. A lot of those things are not only expensive, but very inflexible for us to accommodate. Most of our coaches are teachers, so fitting it into that schedule is really hard for us. So anyone has any resources on that, we'd really appreciate it.
So some of the infrastructure behind the scenes. Marisa?
I'd have to agree that in order for the program to stay and to expand, we really need to be able to provide the community health workers with, they also develop their own social network of community health workers. So being able to kind of have a hub where they can meet with each other, as well as someone to support them finding trainings or support them with trainings would be incredibly helpful.
We founded what's called the Mayor's Health Council, and the health department is a part of that. When we have our walks or different events in the community, we ask that they come out and do health screenings. That's a big part of getting people to understand what they're up against, and it's also that belief factor that something bad can happen to me. So that, by getting those numbers, that pushes them into doing something to help themselves. So we use the state health department or any other medical facility that we can get our hands on to show up to do health screenings.
Yeah, that's a great point too. Just presence at events, big community events or events that we're hosting, having a table, having fun, interactive things for the kids and their families are really important.
That seems like an important linkage to make across sectors for the public health sector to do that. Terrific question. Dr. DiPietro.
So I want to continue with the economic development. Sean, you may have undersold your program a little bit. I heard you say they're 100% self-efficacy for graduating from high school. That in and of itself, the economic benefits to the individual, the family, the community is substantial, as well as every year that pregnancy in some of these young women is delayed. The economic consequences are tremendous, and if these kids then go to college, they then register to vote, right? And they come back to their community with power. To me, that's health promotion. So.
Yeah, totally. And I think especially in DC, the graduation rate is probably I'd say between 50 and 60% right now. So for the kids to have that kind of confidence is tremendous. You know, for me, the thing about DC scores, and you can cut it down to whatever you want, it's just about giving kids opportunities to succeed in as many ways as possible. And I think even with our older youth that have gone past their 8th grade year and come back to us for service opportunities, or they are doing their college applications, or they're having trouble at home, or whatever's going on, it's either we're helping them or we're finding other resources for them to be helped. And it's about them having the same opportunities to succeed as every other kid. And if we can provide that, we're going to. And if we can't do it directly, we're going to find the next person who can.
Okay, great. My magic clock says 3 minutes. Is that correct? I don't want to go a minute past. I've had the privilege of working with the IOM over the years on a number of initiatives. Never crossed the IOM staff, from what I've heard. I think that one kind of key question that I'd like to leave everyone with and get your all's input on. Your program seems to have scaled, at least gone beyond the DC area, metro DC area. What I'd like to ask each of you how that succeeded, what that looked like for you, and then if you had a magic wand, each of you two, taking success in Vicksburg and San Isidro and scaling it to a target population, what would you do? So what would you say is the top reason that DC, America now, is scaled so broadly? How did that happen?
I think we were able to really identify those core components of the program, and from there build out a training platform to allow our coaches to get the knowledge that they need to deliver the program in the best way possible. And that's grown since I've been at DC Scores the last 6 years, and I think especially with technology and the different ways that we can train people and get people knowledge as well as get knowledge back has made it even easier for that to happen. So I think in Skinny, it's the being able to replicate the important parts, but more importantly, train to those important parts.
How did it get out of the Beltway? You can train and provide those kind of that guidance. How does someone in Kansas know about this?
Yeah, good question. And maybe
Thanks.
someone in Kansas here will take it back home. That's all it is really, just that same know-how of the program, having someone active in the community to take those next steps and
leadership.
bring it there. Exactly.
Leadership.
Well, I guess I can quote Harriet Tubman, who said, "If I could have convinced more slaves that they were slaves, I could have saved thousands more." Our job, especially my job in my community, in my state, is to raise awareness and prompt action. And that's what we have to keep doing. My community is 25% of that community is in poverty. And I have to do all I can by reaching out to every single stakeholder and standing up in a leadership role. And I hate to keep saying I, because really the elected officials, all of the people in the community that are role models stand with me. And my job is to create even more role models in the underserved community, because that's who people follow, is role models. We need more role models in our community. And so for me, I would like to see many, many, many more role models saying, look at me, I did it. That's what will make someone else do it too.
So leadership.
Leadership.
For us, the plan at the moment is we're creating a program package with manuals and training videos and whatnot to be able to give this program to any organization who would like to implement it within their agency. And I think, though, that the way that the program is designed and the materials that we can provide, and if we can provide some sort of training to these organizations to be able to implement the program, it's not a complicated or difficult program, especially now that we have the community health worker model being kind of expanded. So any organization who has community members who can serve as volunteers would be able to really utilize this program within their own organization. Of course, funding for training opportunities would be probably the biggest challenge, but otherwise, outside of that, it's really creating those partnerships within the community to leverage the locations. So being able to put that in schools or in recreation centers and working together as a community. But again, I think that leadership definitely plays an important role in that, and being that person, I think, to be able to go and create the partnership and say, okay, we have this program, we have all these people who are going to do it. How will you let us have this in your location? That's definitely where we see it going.
Please join me in thanking our participants today. It's been great. Thank you all very, very much. And I'll turn the podium back over to Russ Pate for some final remarks. We can go. We can go. Mm-hmm. Thanks so much.
So thank you all very much. I'm going to conclude the session here by quickly relaying 3 anecdotes that have sort of come through my head and stuck there over the last week or two that I think collectively capture where we are with this challenging issue. One issue was in the papers just here in D.C. and on TV in the last few days. There's a so-called free-range family in Silver Spring, Maryland. And I'm not going to be passing judgment on this because all I know about this is what I saw in the news and read in the paper. But apparently the family was encouraging their elementary school age kids to walk to a nearby park on their own and unsupervised by any adults. And apparently this, a few months ago, this resulted in the police picking up the kids and the parents being cited for child abandonment or some unfortunate situation. And then it happened again, I guess just the other day. The kids were picked up again and actually taken to Child Protective Services. Now, I don't know in this case who's right and who's wrong, and I'm not going to try to pass judgment on it. I just know that whoever is right in this case, it's a sad, unfortunate situation. So if the police are right, and it really isn't safe for these kids to walk a few blocks from their home to a park and play in the park and then turn around and walk home, I'd call that a very unfortunate situation. If it's the other way around and the parents are right, it is safe, and there's this perception that it isn't, and the police are intervening, well, then that's sad too. And so this is coming from somebody that grew up in 2 small towns in upstate New York, where I promise you, we measured the radius of free range in miles, not blocks, right? I mean, literally. I mean, we were all over these towns. And so that's one story. And sort of captures maybe what a challenging situation we still have in some ways. And then the second one is a much more positive story. Just a couple days ago, I mentioned this in the earlier roundtable meeting, John Hancock announced that they're going to be, for their life insurance clients, providing incentives for adopting and maintaining a level of physical activity that meets guidelines. And of course, the catcher with this sort of thing in the past has been, how do you know they're doing it, right? And so they're going to give Fitbits to everyone that would like to engage in this, and the data get uploaded, and there's a sort of an objective monitoring of whether they're compliant. And as the CEO presented this, it's going to go even further than that, and there'll be an ongoing interactive relationship between the company and the clients that he at least claimed was going to fundamentally change the relationship between a very large health insurance company, life insurance company, and its clients. So that's sort of at the other end of the extremely positive development from my perspective, and something that you could imagine, if this catches on and is adopted by other life insurance companies, could positively impact in a very powerful way, with financial incentives, the behavior of millions and millions of people. And then the third one is a little more personal. I have a friend in California who coaches high school cross country, both the boys and girls teams, and this is where this lapses into something where my friends in the audience won't be that surprised, but this has to do with prom dresses, of all things. And so I was totally unaware that apparently high school girls now put up their own website and post their prom dresses so that the other girls can see which prom dress they're going to have, to avoid 2 girls having the same prom dress, right? All right, so this is going on in this high school, and there's a chat room associated with this website, and some of the girls chime in and say, oh, God, got to lose weight, going to get on a diet. Got to get on a diet so I can fit into my prom dress. And the girl who was the captain of the cross-country team got into this chat room and said, well, hold on. No, probably not the best way. Wouldn't it be better if we ran to, improve our fitness, our weight, and get in the prom dress? So what that struck me as is a reminder that we talk about these policies that might operate at the national or macro level, but in the end, there's nothing as powerful as something that's right there in your immediate social group. And so I now have a little buddy out there in California who I'm emailing with, but I just thought that was just the coolest thing. Number one, she had the gumption to do it, and had the right idea, and just struck me as an exceptionally positive step on her part. So clearly we've got a big job on our hands, but I think we've heard in the last couple days about some great science and some great practice, and I'm an optimist. I think that if we can continue to engage the tremendous researchers that we've heard from and others, and if we can continue to attract the tremendous service of professionals such as those that we've just heard from, Linda, and Sean, and Marissa, I think we're going to get there. So I hope everybody travels safely. Thank you very much for being here, and we'll be in touch soon. Thank you.